Hi, everyone. Welcome to our newest episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole, Director of Marketing and Community Relations at Nashville General Hospital.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. February is Heart Health Month, and joining us this afternoon is Dr. Henry Okafor, Chief of Cardiology here at Nashville General Hospital and an Associate Professor at Vanderbilt Medical Center.
Dr. Okafor was a chief resident at Meharry Medical College and completed his fellowship at Vanderbilt University Medical Center in general cardiology and electrophysiology. Today, he will have information on the 7 keys to heart healthy living. If you have any questions, please feel free to comment below. Please welcome Dr. Henry Okafor.
Thank you, Kathy and Kellen. I appreciate the invitation. This afternoon, I want to briefly share with you the 7 keys to heart healthy living. And this is more without the slide, except you want to write it down because they are very simple and straightforward. Number one thing, this is what the American Heart Association has titled Life's Simple 7. Life's Simple 7. And we can put it in the chart or somewhere there for those who want to remember that Life's Simple 7 are the 7 keys to a heart healthy living. Number 1 is exercise. You are designed to move. So you want to move around. The recommendation is that you get a minimum of at least 30 minutes of moderate intensity exercise for at least 5 days of the week. So at least 30 minutes of movement. At your pace to start with, increase your pace with time, build it. If you can get to more than 30 minutes, great. For most days of the week, if you can do that regularly, you strengthen your heart and you improve your chances of living longer and reduce the risk of heart attack or heart disease, okay? So that is number 1. Exercise is key. And you don't have to do all the 30 minutes at one go because we know we all have time constraints and people can't find 30 minutes at a time. You could do that right at work, take 10 minutes break, 10 minutes here, 10 minutes there. If you do 10 minutes 3 times a day in between work, you will get your 30 minutes. But if you have time to do some after work, before work, whatever works for you, get a minimum of 30 minutes of just aerobic exercise, walking, bicycling, whatever is available to you. That is number 1 key to keeping your heart and blood vessels healthy, okay? Number 2, I'm sorry we don't have the presentation, but I wish there's a way we can project this somewhere. So in case people forget, we're gonna write this down. Exercise is number 1. Number 2 is to control your blood cholesterol level. Cholesterol level needs to be kept, your total cholesterol needs to be kept below 200 milligrams per deciliter. So just remember the number 200. Your total cholesterol should remain below 200. So controlling your blood cholesterol is key to keeping your heart healthy. We know that the heart disease is the number 1 killer of Americans, and the key to staying healthy, the commonest cause of that is blood cholesterol plaques forming in the blood vessels to the heart. Those cholesterol plaques in the blood vessel, forming the blood vessels to heart and narrow the lumen of the blood vessel, and eventually it will rupture and totally block it and give somebody a heart attack. So if we can cut down the amount or the cholesterol level in your blood, you reduce the risk of having heart attack and the consequences of that, okay? So keep your cholesterol less than 200. Check it with your primary care doctor. If you don't know what your number is, this is a number you need to know. what is your cholesterol level. 200 is the key. Now that's the total cholesterol. There is what we call the bad cholesterol and the good cholesterol. The bad cholesterol is otherwise known as LDL. That's low density lipoprotein. So LDL is the bad cholesterol. That number should be less than 100 optimally. For bad cholesterol should be less than 100. Your good cholesterol is called HDL, high density lipoprotein, HDL. So the good cholesterol number should be more than 50. So if you think about it, these are well-rounded numbers. Total cholesterol less than 200, bad cholesterol less than 100, good cholesterol more than 50. 50 or above is fine. So very simple, right? So exercise, cholesterol control. That's number 2. Number 3, learn to eat better and smarter. Healthy diet, okay? And we're not talking about dieting or anything like that. We're talking more about eating healthy, being smart. Don't eat too much of high calorie diet or high fat food. Eat more about vegetables and fruits, and always look at the food level to make sure that you're not consuming excessive fat, especially saturated fat. Cut down on the amount of calories you're taking. Cook your food in smarter ways, like, baking or grilling or, other ways than frying. Those things will minimize the fat content of your food and reduce the risk of heart attack if you eat healthy. So the vegetables and the fruit should be about 2/3 of your plate of food or what you eat, and eat moderate sized, like small amounts or quantities, eat smaller quantities to help you, right? So eating smart is number 3. Controlling your cholesterol is number 2. Exercise is number 1. Now we're working our brain, understanding and recording it, right? So, okay, I'll move to the next is losing weight. I know it's just February, second month of the new year. Everybody makes a decision to lose weight at the beginning of the new year. February is about the time everybody breaks it, right? We give up on our New Year resolutions by February. But generally speaking, it is helpful to your overall health, and particularly your heart health, if you control your weight. We use what we call BMI, okay, to determine what's appropriate. That's the body mass index. And we like to keep the body mass index less than 25. Your primary care doctor can help you determine what is your body mass index, so you know how much weight you need to lose. But most people need to, lose weight. And the best way, of course, is through eating smart and exercising regularly, like we talked about. If you do that combination, you can keep your weight down, or at least maintain it so that it's not going up. The higher the weight, the higher the risk for heart disease and all its associated complications, okay? That's number 4, losing weight. Number 5 will be managing your blood pressure. We want to keep blood pressure well controlled. The normal numbers are accepted by the American College of Cardiology and American Heart Association for normal blood pressure is 120/80 or less. So 120/80 millimeters of mercury or less, okay? So you want to keep your blood pressure less than 120/80. The best way to do this is maintain a normal weight, exercise regularly, eat smart, stay on a low salt diet. Heavy salt intake, whether directly or in the foods you eat or you add it to your cooking, all that tends to drive up your blood pressure. Your goal should be to keep your blood pressure lower than 120/80. If you do that, you reduce the risk of both heart attacks, strokes, and heart failure, and all kinds of heart diseases. Okay, so that's number 5. Good. Number 6. Was that number 5 or number 6? I think. Okay. Did I give you? What have I given you? What?
You've given us 5. You've given us 5 so far.
Okay, so let's go to number 6 now. So number 6 will be stop smoking if you smoke. Don't start smoking if you don't smoke. All right. Smoking is a no-no. It causes damage to the heart, and it puts you at high risk for heart attack, besides other diseases like lung problems, COPD, or even lung cancer. But particularly with regards to the heart, you don't want to smoke. That's dangerous for your health, okay? So, and that includes secondhand smoke. You may say you don't smoke, but if you hanging out with people who are smoking, and you're exposing yourself to that, you're also inhaling that smoke. That is damaging to your blood vessels and to your heart, and it can put you at risk for heart attacks. So no smoking, and if you already smoke, make a resolution today to quit smoking. Take steps. You can start, cutting down. Maybe if you smoke 1 pack, you can go down to half a pack, and maybe set a timetable and tell yourself, over the next 3 months, I want to completely quit. And you can cut it down, maybe 1 stick of cigarette per week. If you're smoking 10, next week you cut down to 9, next week you cut down to 8, and maybe over a 10-week period, you'll be able to wean yourself off cigarette because it is dangerous to your health. Okay, so smoking cessation is key to staying healthy. I think we talked about, so I've talked about exercise and blood cholesterol, eating smart, managing your blood pressure, losing weight. And then the final one that you must remember is to keep your blood sugar under control. Diabetes is a major risk factor for heart disease. So if you keep your blood sugar under control, you reduce the risk of developing diabetes, which reduces the risk of heart disease. So number 7 is to control your blood sugar. What's the best way to do that? Eat smart, exercise, maintain good weight. It's a recurring thing. It's not, you see, it's about the same thing. So doing these same things over and over will give you a chance to have a good heart health and protect you from diseases and the debilitations that are associated with these diseases. So these 7 basic things, which are not difficult, they are just natural things that you should do, and you see that the same things feed into your wellness, okay? The 7 things that feed into your wellness: exercise, normal weight, eating smart, avoiding smoking, maintaining your weight, keep your blood sugar under control, don't have high blood sugar. Ideally you want your blood sugar not to exceed 120, when you wake up or before you've had something to eat. That will help you reduce your risk of having heart disease. There are things that cause heart disease that you cannot change, like some part of heart disease is inherited, it's genetic. That you cannot change your gene for now. Your ethnicity might put you at risk of certain types of heart diseases. You can't change that. Your age might put you at risk of certain heart diseases. You may not necessarily change that, but you can modify or reduce the chances of those causing problems if you do these 7 things. And that's really all I want to share with you as to how to keep your heart healthy. And I'm happy to take any questions and let you know what services we can offer you. Thank you.
Thank you, Dr. Okafor, for all of the information that you shared. To your point, those 7 habits or healthy habits for heart health that you share are things that we, I guess would more so be common sense, but a lot of times we all fall a little short. We all fall a little short sometimes.
Yes.
But we do have a few questions in our Facebook chat. And for any of our viewers out there, if you do have a question for Dr. Okafor about heart health or even our Heart and Vascular Center here at Nashville General Hospital, please make sure you ask in the chat room. So one of the questions is, what age do you have to be to get a left cath for the heart?
Okay. Thank you. That's a good question. So a left heart cardiac catheterization is the full name, otherwise known as an angiogram, is an invasive procedure we do to look at, assess if there's any blockage of the blood vessels to the heart, typically by cholesterol plaques. Now, that is a procedure that we don't do lightly because it's invasive and it's going all the way into your heart. There's no given age where somebody gets mandatorily gets a left heart cath or angiogram. It depends on your doctor's evaluation. So if you saw your doctor, either primary care doctor, or you saw your cardiologist, they will usually assess you depending on what symptoms you have, what you might be complaining, and they may do several other tests to convince them that you are at risk or that you have need for that. We do not do it except there is good evidence that the benefit of doing it outweighs the risk of doing it. And if at that point, regardless of the person's age, if following assessment would feel that they will be benefiting from a left heart cath, then we will recommend it. But it's not like a colonoscopy or something we say, oh, everybody who turns 50 should go get a colonoscopy. No, left heart cath is not that way. It is only done when it is indicated. If you're having symptoms of chest pain, or you have a abnormal stress test, or you come in with a heart attack, then yes, it will be done. But it is not done routinely. Thank you.
Thank you. And then another question came into Facebook. So what is a fib? Is there a cure for it?
Okay, very good. Another good question. Atrial fibrillation is shortly, in short form, most people call it AFib. So the actual full name is atrial fibrillation. So atrial fibrillation is an abnormal heart rhythm that rises from the upper chambers of the heart. So the heart has 4 chambers. There are 2 upper chambers. The atria, we call them, you have a right and a left atrium. And then you have a right and a left ventricle, the lower chambers, okay? So the ventricles pump the blood, the atria brings blood from veins into the ventricles, and then the ventricles pump it into the body. The left ventricle pumps into the body, while the other one pumps into the right side. But the atria sometimes will develop this abnormal, very fast, irregular rhythm that makes those upper chambers to just quiver. So instead of pumping blood, they are just quivering. And because they are quivering, blood tends to slow down. The flow slows down in the atria and stagnates, putting the person at risk of forming blood clots in their heart. And that can be dangerous because when blood clots form in the heart, they can dislodge and go to any part of the body and cause problems. Particularly if they go to the brain, the person may get a stroke. If they go down to the leg, the person may get cut off of blood supply to their limb, and they may end up needing an amputation. If they go to the kidney, they can cause kidney failure. So they can go anywhere from there. So that's the danger. Besides that, because the upper chamber is only quivering, the heart may not be giving out enough blood supply to the body. So the person might feel tired, short of breath, just not feeling well. So atrial fibrillation is that abnormal rhythm that quivers and reduces the effectiveness of the heart and therefore puts somebody at risk for stroke and other complications. There is a treatment for it now, okay? When it is detected, there are different medications that can be used. You definitely need to see your doctor and come to the cardiologist and we will make recommendations as to what medications you need to be on. Sometimes you might need to be on a blood thinner, you might need to be on medication that slow it. And now there are procedures that help it. We call atrial fibrillation ablation. We can send you and do this procedure that has a very good chance of terminating it if you're a proper candidate for that. So you can do AFib ablation. So there are different treatment modalities that are available that we can offer you if you have atrial fibrillation. Thank you.
Thank you. Thank you. So earlier, Dr. Okafor, you spoke about family history, and family history of heart disease can definitely determine if you do have heart disease later on in your life, in that lineage. But I guess I wanted to ask, for any of our viewers that may be currently pregnant or do want to start a family, what should they know about their heart health, and then how would that affect their potential pregnancy?
Oh, very good, very good. This is a great question. Actually, this month of February, the Association of Black Cardiologists is focusing on maternal health as part of heart disease awareness, because we recognize that heart disease can affect pregnant women, and it can affect the outcome of their pregnancy and their well-being beyond pregnancy, and even that of their children. So a woman that is pregnant can have a lot of risk, heart disease risk. So it's important to know what your family history is in terms of, is there any family history of heart disease or heart failure, any kind of heart problems? Find out from your parents, if they had any kind of heart problems, if they've had any kind of heart procedures, at what age did they have it? Did they have it during pregnancy? Or was it something that happened when they were much advanced in age? Or what kind of treatment did they get? That helps to know how to anticipate and plan your own care. So a woman that is pregnant, of course, has to see her obstetrician and gynecologist, who will monitor both her blood pressure, her blood sugar, and her heart function, in addition to monitoring her baby. And sometimes they will partner with a cardiologist if they find there are a lot of risk factors for heart disease. So they usually send you to a cardiologist if they find that you maybe already have a heart problem, or you are developing severe hypertension. Some women, when they're pregnant, they have what you call hypertension in pregnancy. Some people already had hypertension before they became pregnant. Some people, hypertension develop when they're pregnant. Others get diabetes with pregnancy. So all those have to be managed with your obstetrician and gynecologist, along with your maybe cardiologist, who will advise on the best treatment under that circumstance, both during pregnancy and after pregnancy. So heart health is important, and we are increasingly recognizing that what happens in pregnancy with regards to your heart health, like hypertensive crisis, can affect your heart health long time, 10, 15 years down the line. We're finding that many of the women who had a heart problem in pregnancy might eventually develop heart disease. So it's important that even after pregnancy, when you may not have that problem, that you follow up with your doctor, make sure you get monitored to prevent the full-blown heart disease from developing if it hasn't already happened. Yeah.
Thank you. Thank you for answering those questions.
There was another question that came through about if, as people change and improve over the years, if you were diagnosed with high blood pressure, say 20 years ago, and you've been on that same medication, at what point would you need to ever change that medication?
Okay, good question, thank you. So, science is dynamic, particularly medical science. Things change, we keep learning and discovering better ways of doing what we have done in the past. So there are some medications that were used in the past, and sometimes it works, but sometimes we find there are maybe better ways of doing that, maybe better medications or newer medications, or people have some side effects Now, typically, if you're tolerating what you've been using and it has worked for you, and you don't have any side effects from it, you probably, will continue to take it. But that's a decision that you have to make with your doctor, who knows you and who can review things and tell you the pros and cons of either continuing or changing that medication. It's difficult to speak to a specific person without knowing your individual history and other challenges. But generally speaking, you take that kind of issue to your doctor and they'll be able to review it and tell you, oh, based on maybe new information or so, it might be better to change to X versus Y. Or sometimes they may say, hey, this medication works for you. You don't have any side effect from it if it's still available in the market, because sometimes part of the problem is some of the medications are no longer available in the market and you have difficulty getting it. So if you like it and you're still taking it, your doctor may decide that you should keep taking that. But things change truly, and you should always review what you are doing with your doctor so he can specifically advise you. It's not a one size fits all answer. You don't have to change all the time, but sometimes you might need to. I hope that answers your question.
You had talked about smoking being one of the 7 keys. What about secondhand smoke? Is that just as dangerous?
Well, yes, I did mention when I talked about smoking that it includes secondhand smoke or passive smoking, because sometimes if you are hanging out with people or in a place where others are smoking, you might be inhaling some of that. Yes, the studies have shown that it's equally dangerous to your health to be exposed to secondhand smoke. And that's why we tell heart patients and people who want to prevent heart disease to avoid secondhand smoke. Avoid first-hand smoking, of course, but do not expose yourself to secondhand smoke. If in your house somebody smokes, you might persuade them to stop, or they should smoke away from the house so that you're not having to inhale that smoke, afterwards, because it's just as dangerous to your health. Yes.
And then I do have one more question for you, Dr. Okafor. So while we're on the discussion of smoking, are there any programs or any websites or any resources that are readily available for anyone that that may be viewing today that is trying to quit smoking? Because I know, from multiple resources that it's a process. It's definitely a mental process, trying to break any habit that you've built up. So are there any resources that you could provide to our audience or any websites you would recommend?
Well, thank you again. Smoking cessation, there are a lot of resources, there are a lot of programs that are focused on helping you quit smoking. The first and foremost, I would say, is your primary care doctor, because I'm not sure where you are listening from, but depending on where you are, if you speak to your doctor, they typically have places that they refer their patients to help guide them. So you need to know the local resources in your area to say, okay, where do I go? What do I get? There are some medications that your doctor can prescribe for you, which might help you, okay, with quitting smoking. At Nashville General Hospital, there is a smoking cessation clinic and a family practice clinic that that caters to this. So if you call Nashville General Hospital at 615-341-4100, they can help guide you to log on to the family practice site and get an appointment for the smoking cessation clinic. So that's one place you can be helped, or call in for our primary care doctors to see them and let them know what you need. They have psychological counseling. They have all kinds of resources to guide you into that. And of course, if it's a cardiac issue, you can always come to Nashville Heart and Vascular Center, and we'll be happy to help you address your heart issues or questions. Okay.
Well, thank you, Dr. Okafor, for all of your time today. And thank you to everyone that's been viewing. That is all the time that we have for this segment. But if you have any additional comments or questions for Dr. Okafor, please continue to comment in our chat, and we will be sure to make sure we pass on those questions to him. And or if you're interested in scheduling an appointment with Dr. Okafor, please call 615-341-4250 or visit NashvilleHealthcareCenter.com.
Thank you. My pleasure.
And please join us for our next Wellness Wednesday event on February 23rd at 12:15. Have a great day, everybody.
Have a great day, everyone.
Good afternoon.